I would say my favorite part of my job is when I get to treat a pregnant mom, whether it's for the last 10 weeks, whether it's for their entire pregnancy, whether I'm the first one that they tell that they're pregnant, because that happens sometimes
Oh my
because
God.
we change things up, of course.
Yep.
And yeah, treating that pregnant mom, taking them to the point of when they go into labor, and then getting to meet their baby. I think that's like my favorite part of my job. And yeah, just like that trust that they have. They're like, okay, when can I bring my baby in? And so I always give that preface of like, whenever you feel comfortable.
Mhm.
And all of a sudden you're like checking your schedule for the next week and you see their baby pop into your schedule and you're like, oh my God, I'm so excited. I get to finally meet them. We've been talking about this person, this
Mhm.
he, she, they in your belly for 10 months or so. And now finally getting to see like, oh, what color's their hair? What does
Yeah.
their face look like? What did you name them? I always ask like, how did you guys come up with the name, or like all of those things. So I would say that's probably my favorite part of my job.
Welcome back to another episode of Beyond the Birth Story podcast. If you are joining for the first time today, I'm your host, Alyssa C. Girl mom, angel mama to one of the sweetest boys in heaven, birth trauma and uterine rupture survivor, and former NICU mama. Here you will have the opportunity to ask and have your burning questions answered by professionals, feel connected to other women's experiences as we normalize the different aspects of this journey we are on as moms. The real and raw moments of healing are shared here as we navigate loss, embrace strength, and find hope again while learning to live after loss. Please note the topics discussed on this podcast are for educational purposes only. Please see your personalized medical professional if you have any questions or concerns that arise from listening, including diagnosis and treatment. All right, so this is literally so exciting because it's not only a personal but a professional milestone for you today of appearing on your first podcast, which I 100% recognize that is not an easy thing for everybody to do. It's not a comfortable thing for everybody. And so I think that alone of you showing up here today is like something to celebrate and something to be extremely proud of. Something that has been on my heart since like we kind of talked and you agreed to share this space with me is that I really wanted to share with not only you, but everybody who's going to be listening to that, is that when in your care, you have helped our family so incredibly much, and not just from a chiropractic perspective, but you know, when we enter your space, it's so energetic. You are so easy to talk to. You meet everybody where they're at. And I just feel always so much better when I leave your space. And so I think it's so important for everybody, you know, especially moms and their babes, to have that kind of care. But literally everybody that has a provider that, you know, takes the time, has as much passion as you do, and that really, really radiates. So I wanted
Thank you.
to tell you that. I'm like, I have to share this. And
Aw,
so,
thanks.
yeah, you're not just aligning our bodies, but it's so much deeper than that, which I totally appreciate. And so I'm excited to kind of showcase you as a woman and all of your knowledge today. I think that this episode is going to be extremely informative for everybody. And oh, I just can't wait to show you off.
Yeah,
So,
thank you.
so much to cover today. I'm it's like
Yes.
going through our list again this morning, and I have my little phone here so that I don't forget anything because there is
Yeah.
literally so much, and you're going to bring so much value. So, without further ado, Dr. Alyssa Clarkson, welcome to the Beyond the Birth Story podcast.
Hi, I'm
And
so excited to be here.
I will give you the honor now of introducing yourself, whatever you are comfy sharing.
All right. So, as she said, I am Dr. Alyssa Clarkson, and I'm a family chiropractor, and I work at a clinic in St. Albert called Sublime Health. And I have very special interest and a lot of extensive training in pediatric pregnancy and postpartum care, which I am so passionate about. So, yeah, it's super fun to get to meet a bunch of families. And not only do I just get to meet like the moms when they're pregnant, but also the babies. And then obviously the moms then be like, oh, my husband's been complaining of this. So then all of a sudden I see the whole family, and it's just like so fun to be a part of. You hear so many stories about everyone in the family, and then all of a sudden you get to meet them all. And yeah, it's just so fun.
And too, like, I think, well, I was connected to you via another preemie mom via
Yeah,
social media. And
of
so
course.
that's kind of fun too, right? It's like, the world is such a small place. And like you said to me before, you've listened to episodes, you're like, oh my God, I know that girl from back in college, or I can't remember
Yes,
exactly what it was, but which is so fun. And I love that we're all a part of this community. And
totally.
so something I want to start off with, like, um, latch dysfunctions and tongue tie, lip ties kind of thing, because that was something that we experienced personally. And
Yes.
so I will again give you the floor to kind of share everything to do with that.
Awesome. Yeah. So I've taken extra courses in learning how to assess for lip ties, tongue ties, and oral dysfunction. So one of the biggest things that I find is moms come in and they're like, if they want to breastfeed, it's so hard. And one of those things that you just think is like, oh, baby's just going to latch on there and it's just going to be so easy. And no one tells you that it's not.
Mm-hmm.
So one of the things is if you do really want to breastfeed, or that's one of your goals, um, if there's pain or the baby's struggling, you are probably going to give up a lot quicker, right? And just for your own mental health, which is totally fine. But we definitely need to know that there are resources out there and ways that we can help. Um, Obviously, finding someone that has done that extensive training and knows what they're looking for. But once we assess, and if we do see that there is any dysfunction, we can send you to a pediatric dentist or to a lactation consultant or anyone else that can also assist us. So, with our latch dysfunction, when we are assessing for it, so in an appointment with our babies, we'll go inside the mouth and check. I mostly go for function. So we will check to see if there's tethered oral tissues, but if there is and their function, like sucking is okay or their tongue movements are okay, mom doesn't have any pain at the breast and they're eating fine, gaining weight, we kind of do a little trial of care and see how it goes. And if things are not progressing how we think they should, or we start to get more pain, we can always look at sending and referring out to that pediatric dentist for that clip. So, yeah.
Yeah, I totally appreciated that because we ended up having complete of both and
Yes.
literally changed the game. Something else too is obviously we had a very preemie at 28 weeks, but that like roof of the mouth, like with the kind of like flat palate, and being able to kind of like mold that over time, and even just from such like small movements, obviously, like it wasn't anything extensive, right? But just
Yeah.
even when you're checking kind of that oral dysfunction and everything too, right?
Yeah.
um Moving down to I'm just gonna move down the body at this
Sounds
point.
great.
The neck. So with neck rotations, obviously, and I think I often forget, like, and I've had C-sections, so it's like a little bit different. But when babies come out of the birth canal, like they're so manipulated and squeezed, and even like C-sections, depending on how they're laying in the womb, I think I forget that obviously these babies are probably out of alignment. They don't just come out perfect. Well, they are perfect, but
They are perfect.
internally they might be a little sore. So,
Yeah.
like, all things neck, what does that look like?
Yeah. So actually, next does also play into the latch as well, because if baby is preface or having a preference for one breast versus the other, maybe it's because they can't turn their head, and maybe it's just because how they were positioned in utero, or if they had a traumatic birth, or even in the most perfect situation, that baby has to come out of a 10-centimeter hole, and everything like they're probably pulling on them a little bit, and babies can't tell us what's wrong with them. So we kind of have to look for certain um, signs and symptoms that they maybe can't turn their head. Maybe they're developing a flat spot. They prefer to feed on one side versus the other. So that is one of the bigger things that we do look for in our assessment, is that neck rotation. One of the other things that I always, so if we are bottle feeding primarily, making sure that we're swapping both sides, because baby likes to turn and engage with you when they're eating. So everyone, if they're right-handed, probably has that preference to hold baby over here and feed like
Mm-hmm.
this, right? If they're always in that position, they're more likely to always be putting that pressure on the one side of the head, and can develop that flat spot, which isn't always a problem at the beginning, because once they start getting up, sitting up, rolling, being more in tummy time, we can kind of develop that back into a symmetrical head. But sometimes babies need a little bit of help and we have to get them helmeted. But we have also a very good referral source that we send to for that too. So just looking for those signs and symptoms and making sure that we're giving our babies the best opportunity to be able to turn their heads both directions, because they have those instinctual wants to look towards you and be comforted by you. So just making sure that we do certain things like that.
Very good point about the bottle feeding and switching the sides. I am breastfeeding, but whenever I do give a bottle, it's always I'm always holding it with my dominant hand. So that's
Yeah.
a very good piece of advice. When we're talking,
But when you, oh, sorry,
no, go ahead.
when you are breastfeeding, you're switching both sides naturally. So
Yeah,
people don't think about it. But when you have
yeah.
a bottle, you're like, oh, this is how I'm going to do it every time. Or if your in-laws or your parents or whatever are coming over and they're also right-handed, every person that's feeding them is probably feeding them on the same side. So I always give that little tidbit to parents either way, because you might bottle feed at some points also. So yeah.
I love that. When we're in terms of like flat head, I automatically assumed that it was like the back of the head. Can we see it kind of on the sides and that kind of thing?
Yeah, absolutely. So when we put a lot of pressure, say like on the back right side of our head, sometimes we can deform in both directions. So we can have more of like an oblong shape. Some people will, or some babies will have exactly like just right on the back of their head from laying there and not moving both directions. Sometimes I more commonly see it either on the right or left side of the like posterior, the back of the head.
Mm-hmm.
And then if things aren't evening out, we can see starting to bulge at like the front. But if we catch it early enough, it usually isn't a huge problem. So yeah, just monitoring for those things.
Mm-hmm.
My babies, I tend to see for maintenance if there's something that we're working on. After that, I try to see them like once a month in especially their first year of life, because a baby's spine grows almost 50% in the first year, which is a huge amount for a small
Mm-hmm.
baby. So just making sure that we're catching those things before they become a problem. And usually we don't send them for that helmet assessment until closer to that 6 month mark anyways. So we do have a lot of wiggle room if we catch it early.
Mm-hmm. So before that kind of 6 month mark, we can it'll correct itself. They're so malleable and stuff for so long. And I forget that too. Cause I'm like, oh, at 6 months, like everything should just be good. And then it's like, no, six
Yeah.
months in baby time isn't a long time, but they change so incredibly much in that 6 months. It's hard to remember that.
Yes. And it depends on the severity of the flat spot.
Mm-hmm.
So, if it's pretty severe, like if they had like say if they were in utero and they were always on that right side of the head, or they were shoved into your pelvis on that one side, they might have a more prone chance of having that flat spot. And if it's just mild, once they start like sitting up and not being on their back as much, and rolling and all of those things, we're putting less pressure on the head. So that's why tummy time is also super important too. But that's why I think they give that 6 month mark, because we have a little bit of time and they start doing so many different milestones during that first 6 months of life. So yeah, that's kind of why I think that's the 6 month mark.
I was like, once I was reading through this, and I'm like always looking at cases, and I'm like, is it flat? Or is this like your normal head shape? Like, which
Yes.
I'm like, I need to get this looked at. But I think
Right.
that's just me again being an anxious preemie mom. I'm like, I'm just waiting for the ball to drop. Like, what
Yeah, you're
is
like, what's
going to
next?
go on? Yeah, apparently
Yeah.
it's a peanut allergy, so we'll
Yeah.
visit that maybe with an allergist at one point.
Right.
Okay, what is the medical term for like that neck rotation? How do you pronounce that?
Torticollis.
Torticollis. Okay.
Yeah.
I just kept thinking, oh, it looks like tortellini when I was reading it. I'm like, I'm not even going to embarrass myself by trying to um pronounce it is the word I'm looking for. And
Yeah.
then,
Torticollis is just when like those muscles are super tight and they have maybe a
oh, okay.
preference to a side.
Yeah.
Yeah, so you have to diagnose that based
Mm-hmm.
on getting like professional assessments and
Yeah,
stuff like that.
for sure.
Not every baby that has a preference has torticollis, but that's kind of that preference
Mm-hmm.
of side can develop to be a torticollis.
I like that, like, we're able to kind of describe those medical terms in layman's terms. And like, because I think a lot of times, like, even my mom called me yesterday because my nana had surgery and she was like, they didn't really explain things. And I'm freaking out. I'm like, well, what terms did they use? Like, I don't even know. I'm like, okay, so we need to be describing what the kind of these medical terms are, right? And then
Yes.
when you kind of get used to hearing them, it's like, okay, we can breathe. We don't need to totally panic in this moment.
Yeah.
But
And
like,
just, yeah, setting that at ease too, right? Because it's like,
yeah,
okay, these things can be fixed and assessed, and
yeah.
along with like chiropractic and some pediatric physio and all of
Mhm,
those things, like we can really make those changes and differences. And then like giving you guys some exercises and stretches at home too.
mhm. Yeah, I feel like that's so important, is that at home, I always call it maintenance in my profession. I'm like, okay, you need to do maintenance if we're going to see progression and results and that kind of thing. But it's like, it's so hard almost to remember to do things with your little baby because there's a million other things you're trying to do. The tummy time, teaching them to roll over, teaching them to sit. And it's like, oh my Lord.
You
Are
got a lot of things to do.
I know. And it's
It's a
like,
full-time job.
literally, like, everyone who
Yeah,
says maternity leave is easy is lying.
is lying. Yep.
Okay, so the hip dysplasia, am I saying that right?
Yeah, hip dysplasia. Yes.
Dysplasia. Um, can we see, like, first of all, what is that? And I have a girlfriend whose babies were breech, and they had one of them had quite severe. They ended up being in like leg braces and stuff. So is this something that you see mostly with like breech babies, or can any baby experience that?
So any baby can experience that. So basically, hip dysplasia is just when our hip joints don't develop properly. They can be shallow, and it's all like in the development portion of it. So if our babies are not putting pressure into that hip joint, then we can get that like popping out. And that's what we assess for. So basically, in all of my pre exams, in my pediatric exams, I always check. There's an orthopedic test that we check for. And if there's a clicking or popping or anything in the hip, we'll send for an ultrasound just to make sure. Um, I would say that we see it maybe more in breech babies just
Mm-hmm.
because um, their position. And if they're like a footling breech, then they don't have the legs up and putting that pressure into those hip joints. They're down and then they're just kind of hanging there. Um, if they're also in that yeah, so being in a breech position,
Mm-hmm.
sometimes they don't have that opportunity to get that pressure into the hips. So I would say more commonly we do, sometimes even with twin babies, just because there's not as much room in the uterus for them to be.
Mm-hmm.
So yeah, I assess with all my babies, and I would say of the ones that I've seen that I'm like, oh, there's a click, let's send them. There's been a few, I think I've caught two, and both of them were breech babies. So I don't know if that's a correlation or not, but
Mm-hmm.
I always make sure to make a preference or like a really big point of checking the babies that are breech to
Mm-hmm.
make sure that that's not a thing, because it's much easier. Yes, they have to get casted and into those braces, but it's much easier to catch early than when they start to be mobile and when they start like walking and all of that stuff, because once if you have to brace them when they are already mobile, they're going to miss some of those milestones because they can't actually move, right?
Mm-hmm.
I also have a couple moms that are in their like 50s, like early 60s, that it was never caught when they were a baby, and so now they're like having to have hip replacements because they've been having so much hip pain now. And I think that's really important that we are now assessing for it and kind of making it a big deal.
I love that, medicine always evolving so much.
Yeah,
And the specific mom that I'm referring to, she's a huge advocate for asking for those ultrasounds and things like that, just again to check, right?
yeah,
And it's not an easy thing seeing your babies in these braces or casted, but it has like created such an incredible difference for her. And if I believe it was like if her I can't remember if she went to chiropractic first or if it was a physician that caught it. But with her first baby, they did. And then when she had another breech baby, she was the one that had to push for it and be like, can we just check? Like
Yeah.
like you said, they will not be able to hit their milestones and things like that. So to put that importance, and not only that, but the education, because a lot of us, like I've never experienced, so it wasn't on my radar, which especially for those breech moms who know and they're going to have that scheduled C-section. And I mean, you'll know if your baby's breech. It's not going to be a
Yeah.
surprise once they're here. It's like, oh, your baby was breech,
Yeah.
And so it's like the education piece that we can kind of be asking about that even while we are pregnant. Like, okay, is there any things we need to worry about because they were positioned differently, or even like you said, being pushed into the pelvis throughout the pregnancy and stuff. I've had moms that, their babies have the flat head or, difficulty with facial expressions and nerve movement and things like that because like they are so squished,
Yeah.
and our adult bones are not malleable like theirs. And so, yeah, just creating that awareness piece, right? And I think you hit everything on the head with that. I had asked her before, I'm like, okay, I have this coming up. What should moms know? And I'm like, okay, we'll see. And then I'll add my little 2 cents. But yeah, she's
Totally.
very passionate about creating the awareness, which kind of bringing that professional and personal lived experience into it. And I think that really emphasizes how important it really is, right? And
Yeah.
setting these babies up.
And especially with like your first kids, you don't
Mm-hmm.
know what to look for. You're like, oh, okay, like their hip is popping when I take their diaper. Is that a
Mm-hmm.
problem? I don't know. Who do I ask? Should I be worried about that? Right.
Mm-hmm.
Um, and I do have some moms that come in and they're like, oh, I think their hip is popping when I am changing their diaper, when I take their legs up to like wipe. And so I assess and I'm like, oh no, that's their knee or
Mm-hmm.
whatever. And or they're like, oh, it's cracking when I pick my baby up. Is that a problem? And I, you always can ask questions. There's never such thing as a stupid question
Mm-hmm.
or, um, it's your baby. We want to make sure that they're taken care of how they should be and that they deserve the care that they need, right?
Mm-hmm.
Because you have to advocate for them. They can't talk, so you have to, right?
Yeah. And firm believer that you know your baby best, right? But
Yeah.
we also ride that fine line of normal versus abnormal, and a clicking hip. Some moms might be like, oh, that's probably just normal. Like they went through the birth canal and things like that. And however it may be normal that some, in quotations, that some babies' hips do click, it's important that we investigate that so then we can say, okay, yes, it's normal, the baby's fine, or maybe it's something we need to kind of further investigate, right?
Totally. And I
um
always say, like, there's a lot of things that are very common, but they may not be normal. So,
yes.
yeah, that's always one of the things that I always say to my moms, like, yes, this pain is common. A lot of, say, pregnant moms have this pain, but it's not normal to be feeling this, and there's ways that we can help, right? So, just knowing the difference between, like, common doesn't always equal normal.
Mm-hmm. Oh, I can't wait to circle back on that comment when I get to the moms. I'm like, do I have some thoughts?
Yeah, right?
Okay, so addressing like tightness in hips, back, shoulders, jaw, everything for babies. What does like when I obviously when an adult goes to the chiropractor, it's a lot of cracking and very sometimes aggressive movements, that kind of thing. And so I did not know what to expect when I brought my baby to the chiropractor for the first time. And even my husband, after we left, she goes, did she do anything? I'm like, yes. Like, what did you expect? He's like, well, like lots of movement. I'm like, no, again, we're coming back to that malleable piece of the baby. So
Totally.
what does an infant baby child chiropractic visit maybe look like in comparison to an adult?
Yeah, so yes, of course, babies are treated very differently than adults. So when you first bring your baby in, we'll get you to fill out some paperwork about kind of your birth, how things went. how your pregnancy was, anything that happened like post birth, anything that you're investigating. And then I sit down with the mom, dad, both are there. That's great too.
Mm-hmm.
And just ask a bunch of questions regarding what they're noticing with baby, whether it's just like we just want to get baby checked out. We don't really know what we're looking for. And so I'll ask a bunch of questions. I will let you tell your birth story. So I kind of know how things went, who you gave or who you delivered with, where you delivered. And then we kind of go through like, do they have a side preference? How are they eating, latching? Are you noticing any pain? XYZ. So we'll go through all of that. And then we go through an informed consent, and I then get baby on the table and we just do a little exam. So basically I'm going to be checking like those hips, that we mentioned
Mm-hmm.
earlier. I'm going to be checking kind of lower back movements, and then going up the spine, checking like, is there any tightness that I feel kind of in the mid back? Is baby upset when they're in the car seat? Do they not like being on tummy time? Is there like a certain position that you have them in on the floor when you're holding them that they just really don't like being in? I'll check their neck rotation. So I usually have a little rattle that I get them to move their head if sometimes they sleep through the whole appointment. So sometimes I just have to do it myself.
Yeah.
Um, and then I will go and check like head shape, make sure it's all looking pretty good. And then I'll glove up and I'll go inside the mouth. So that's where I assess the palate shape, seeing how that's developing, checking for that lip tie and tongue tie, and just the function of what their latch feels like. Are they fully closing around my finger, or is there like an opening on the side that we need to worry about? Are they getting air in? Do they click when they're latching? Sometimes even babies start to get a little bit upset. So I'll just be like, you can feed them while I'm kind of like assessing them, which actually gives me a lot of information because I
Mm-hmm.
can kind of see what position works best for mom. If there is a clicking on the breast versus on my finger, that kind of thing. Are they getting the whole nipple in there, the areola? Are they getting it all, or are they just really shallow? That kind of stuff. So with babies, we just kind of go with it. If you need to change them in the middle of the appointment, we can do that too. So just making you guys comfortable. And I always chat with the mom, dad, parent that's there, what I'm feeling as I'm feeling it, because you're just watching me, and you don't know what I'm looking for, right?
Yeah.
So once that's all done, I'll kind of give a little update of what I found, what kind of things we'll work on. And then at the end of the appointment, I always give some exercises depending what we're dealing with. But yeah, and then once we get into treatment, treating babies is very, very different than treating adults. So we use a very light vibrational pressure. So I always say, like, if you're checking the firmness of an avocado, that's kind of the pressure I'm using on the babies.
Mm-hmm.
So because babies don't have the same joints that we do as adults, our adjustments are more at the neurological level than they are actually just like cracking the bones and joints around. We also do a lot of like muscular work around. I'm also trained in craniosacral, so that's one of the things I do on the palate and in kind of the jaw. And then so those are kind of the things that we look for and do. We also do some like visceral manipulation, like if there's anything going on, like digestive wise, and just, a whole bunch of different things that we can do with the babies that obviously isn't cracking and popping.
Mm-hmm. And I really do appreciate that, like the communication piece, right? And especially like as an adult, you want to know what's going on during your treatment. And then when you watch your little baby, it's like, please tell me what you're doing. Especially like as a preemie mom who spent so much time in the hospital, I'm like, okay, please walk me through. Like in that moment, you're not the one that's holding your baby and you're trusting somebody else. And so the communication piece is huge for me. So I know I can't be the only one. How young, like, can a baby be when they go to chiro? And kind of when would you recommend, like, age wise or maybe symptom wise? Like, what is kind of your perspective on that?
Yeah, so babies can be treated the minute they're born. There's
Mm-hmm.
no time too early to be treated. I think the youngest baby I've treated was 3 days old, maybe 4. So yeah, just really, really little.
That's so
Um,
sweet.
yeah, which is, it's also like so amazing that someone is trusting me with a 3-day-old baby. Like they're bringing their baby into me because whether they have concerns or whether they're just in there to make sure nothing's wrong. Um, it's very special. I just feel so privileged to be able to get to care for the babies and like have everyone has that like trust in me. It's just like it's so special. But back to our conversation.
I love that.
So babies can come in kind of whenever. I always recommend, so if I'm treating a mom during their pregnancy, I'll kind of tell them like whenever you feel comfortable leaving the house because it's a
Mm-hmm.
huge change. If it's your first baby, if it's your second baby, third, multiple, whatever, we want you to be comfortable and we just want you to feel ready to leave the house because you're trying to care for this baby and you sometimes don't know or don't want to leave the house. So um the one thing I do say though is like if you are noticing like latch dysfunction or it's hurting to feed or baby's like really fussing at the breast, if you're noticing that neck rotation preference and like they just really hate turning to one side, if they're really uncomfortable in any positions or they're not pooping consistently, I usually say those are kind of the big ones to bring them in a little bit earlier if you can, just so we can catch things earlier
Mm-hmm.
before they become a huge problem. But I am a big believer in that every baby deserves a wellness exam. Just like we talked about before, even in the best case scenarios, birth can be traumatic for the babies and just really difficult for them too. And so, if you just think about like they're coming through that 10 centimeter hole or they're
Mm-hmm.
being pulled out via C-section, they're yanking on their jaw, maybe their shoulders, their hips. They're just trying to get that baby out. And especially if there is something that they're like, oh my gosh, we need to get this baby out now.
Mm-hmm.
Like they don't really care. They're just pulling that baby out. So just to be able to have that wellness visit, just to make sure that everything's going well, and so that we can catch things before they do become something, and so that they can grow to be healthy adults and just hit those milestones on time and all of that stuff. So,
Mm-hmm. I even
yeah,
think about like shoulder dystocia.
yeah,
I can't speak today, but
that's
even
okay.
things like that, right? And obviously, again, that manipulation of us moving them in certain ways around your pelvic bone and things like that just to get them earth side, and then the transition from the womb to the real world, like it's huge. And I think everything that we can do to kind of align that for them and help regulate their nervous system and things like that. One thing I find so incredible when Case goes for chiro or his osteopathic appointment, things like that, it's you can see the release in them. And there's some appointments I've gone to where I'm like, I don't really have a concern. However, I just want to do, again, that maintenance piece and just kind of check. And then he just becomes like a different boy during that appointment. I'm like, oh my gosh. So it's like those little like movements and things like that. And, they're not big to us, but when their nervous systems and their bodies and everything are so small and new. And I had never gone to chiro or to osteo for my babies. And, third time's a charm. I guess I'll try it out.
Right?
And it was the best thing and really eye-opening that, yes, the birth and everything plays such a huge part. But also, like you said, their spines are growing 50% and things like that. They are changing so much. And it's like all of a sudden you blink and you've had this newborn or this prem baby, and you now have a 6-month-old who's almost quadruple the size at
Yeah,
minimum. And it's like, holy shoot, like they've changed so much and their bodies are growing, their muscles are, their bones, their joints, everything. And so coming back again to that maintenance piece, and like you said, especially with concerns, maybe seeing them monthly, but even without concerns, I love that 4 to 6 week mark. I feel like everything daily, they're changing. It's
Yeah.
crazy. And
And the small changes are big changes,
mhm,
like the babies, right? So even just like we always do like less is more with the baby because the more you do, the bigger it's going to be for them because they're
yeah,
just so little and tiny. And we just want to make sure that everything is moving well and working well. And but
mhm,
also for the parents' peace of mind and like just to make sure that they can also like, okay, if I'm not sleeping, if I'm not able to feed, if I'm not, it's so much on the parent too. And
mhm,
so we just want to give not only the baby the best opportunity, but even the parents, just like, even if they get 3 days worth of not crazy screaming, that is huge in a parent, right?
mhm.
So, yeah,
I love that. Full picture, right?
yeah, exactly.
Okay, let's see. Crawling patterns. How do you assist with that? What does that look like?
So, yeah, when they start crawling, we mostly just watch them and see how they're moving. Um, there are a lot of people think that that butt scooting pattern is really, really cute in a baby. Um, not super functional and something that we want to avoid happening, um, mostly for their hip development.
Yeah.
And we want babies to cross crawl because that helps with their brain connection. So even just before they start crawling, I sometimes give um, some exercises that the parents can do to try and like start those connections so that when they do start to get into that quadruped position that it's like, oh, I remember this, mom used to bring my right arm to my left leg and like, okay, this is how I'm moving. And so we just really want them to do the crawling. And even though some parents are like, oh, crawling's not a milestone, I still think it is. And
Mhm.
it's super important because of those brain connections. So getting them to go from like on their tummies, being able to roll, and then getting into that sitting position, and then getting onto their all fours, and then standing is kind of the progression we want to see.
Mhm.
And so if there's some dysfunction with their crawling, then we want to just check out their hips and make sure everything's moving well in there and that it's not super tight. And then give some exercises that we can kind of get them to be in that position and just like it's more repetition for the babies because once they get into that, I guess, that crawling position or whatever, they're like, oh, I can get there faster this way.
Mhm.
Just getting into that repetition. And I know it's homework and another thing you have to do with the babies, but just making sure that we're at least trying. And
Mhm.
if they cross crawl for 4 crawls and then they butt scoot the rest of the way, it's like, okay, at least they're getting some exposure to that cross crawl pattern. And yeah, we would really like them to do that. So
Mhm. That's interesting, yeah, because I think as a parent, like, it's all about the milestones and things like that, not necessarily how those things are connected to brain development and whatnot. And I think it comes down to too is like making those little exercises fun too, because once we get to, a baby walking, we have no problem in like holding their hands and helping them with that. And so to like make it almost a game with that, like helping them move, right? And I
yeah,
know even when Case is learning to sit, I'm have no problem sitting behind him and holding the toy or, just incorporating those different things. And so thinking of it for myself lately is less of a I'm going to call it a chore. It's like, okay, another thing to add to my list, but saying, okay, I get to add this into our play today. And I think
yeah,
like verbiage is important for us too, and like getting our minds prepared as, okay, not another thing I have to do, but like, okay, today
but
we
I
get
get to.
to practice crawling, right? And
Yeah. And
making
today I
it
get to
fun.
hang out with my baby and teach them how to
Yes.
crawl or like
Yes.
just reframing that mindset too. And yeah,
Yeah, a lot of it has to do with mindset. And I think too that not I think, I know that these babies, they learn so incredibly quick. And
yeah,
it's like, and I notice it as they get a little bit older too with, I tell Jayla who's 5 one thing and it's like in the moment, it might not seem like she even heard me. And then a week later, she'll be like, oh, but like you said this. And I'm like, oh, I really
oh,
did.
you
Yes.
really
Okay.
listened.
So I'm not just speaking to hear myself talk.
Yeah.
Great. I will continue to use my voice But like, yeah, just those small things. Like you said, 4 little movements. Again, less is more for them. The 4 movements like are really going to trigger things for them that we may not necessarily think as adults. Like, okay, like that's not a huge thing. But again, going back to how little they are and how big the world is to them, it's like, no, that's a lot.
100%.
And yes, the butt scoot is cute, but also so is like their little crawls. So
Yes.
we'll get a little bit of both.
Yes.
Um, so in pregnancy, this is something that I also had to, I think it was with my second for sure, maybe a bit with my last pregnancy, but the round ligament pain. And I was often told that, again, normal versus common. I was always, oh, it's a normal thing in pregnancy. I'm like, okay, so I just have to like be in a lot of pain when I walk for the next 6 months. Like, not
Mhm.
really my jam, not into it. And so, the more I see now, again, of socials becoming such a big thing for professionals to use their platform to share knowledge in an appropriate way for, whoever their audience is to say, yes, these things, I like the word common, might be common, but you don't have to live in agony and pain, because that is what round ligament pain is. I can
Yeah.
personally speak to that.
Yeah.
So round ligament pain, pubic symphysis in pregnancy, what does that look like, first of all? Symptoms for moms to look for, and then management on your behalf.
Yeah. So, yeah, same thing. Round ligament pain and pubic bone pain are a really common thing that I see in like my pregnant moms, but again, not super normal. It can be a dysfunction in the pelvis. It can be just like one side is pulling more than the other because that's how your pelvis is sitting. So just like we do with the babies, I do an exam with my pregnant moms. And everything that we do with pregnant moms are also very safe. And we
Mm-hmm.
also have a very fun pregnancy pillow at the clinic, and you get to lay on your tummy when you get to see me. So I have a couple moms that have come in and they're like, can I just pay you for like an hour to lay?
Like on my belly. That's immediately where my head went. I'm like, what a treat.
Yeah, because I mean, once you hit that like, I don't know, 20-week mark, it's like maybe even earlier for some people.
Mm-hmm.
I usually start getting them on their tummy on the pillow like almost around the 12-week mark because I'm like, you can be comfortable.
Mm-hmm.
But yeah, once you're like getting into that third trimester, like laying on your belly is not a thing. So
Mm-mm.
it's kind of a treat when you get to come to the chiropractor and lay on your tummy for a bit. But yeah, so we just kind of assess. With my pregnant moms, I am trained in a technique called Webster technique. And so this is a technique that we use for our pregnant moms, and I use it for all of my pregnant moms. But basically, what we do is we address the pelvis and make sure everything is aligned and in the best possible position that it can be. Um, we, in Webster technique, I address your sacrum, which is that bone on the back. We also get into a ligament called your sacrotuberous ligament, which is also on the backside, and it has to open up and relax when that pelvis opens up when you go into labor. And then we also do a muscle on the back, which is kind of like that piriformis muscle, so that one kind of right in the middle of your butt cheek. And then when I flip you over, we check your round ligaments. So I have a round ligament release that I do. And then we assess your pubic bone too. So if you think of it, our pelvis is a ring. So if we think that our lower back, if we're having lower back pain, or maybe we're not, but if our sacrum is sitting kind of like this, our front is going to come up like this too, right? So if we're having pain in the back, we might have pain in the front. And that pubic symphysis pain, so I've never been pregnant before, but all of my moms that come in with pubic symphysis pain, they're like, it's lightning crotch. It feels so, so bad down there. They're like, it's
Yes.
shooting anytime I get out of the car, out of bed, when
Mm-hmm.
I move, if I walk for too long, I just get this shooting lightning crotch pain.
Mm-hmm.
And that's the only way they can describe it. And so if we can even just like reduce that to not every time you get out of bed, not every time that you roll over, not every time you get out of the car, that will be really helpful to get you through your
Mm-hmm.
pregnancy. But then also when we're doing that Webster technique, we're also releasing your hip flexors. So those also pull on that pelvis. So we're just doing all of the ligaments, muscles, and the joints around there just to help kind of balance things out and take any strain off any certain area. Our assessment kind of dictates which side that we find. And you could be feeling the pain more on the right side, but it's actually our left side that we need to actually address. And maybe you've just been compensating for so long because it's the left side that's not moving as well. And of course, I try to address the area that is of concern, but usually we kind of assess and see what side is actually the problem, and then just tell the parents, like, or the pregnant mom or whatever, like, this is what we're finding and this is probably why. So yeah, just you grow more in the 9 months than, or grow and change more in the 9 months than most people do in 9 years when you're pregnant. So just so many different changes, and your biomechanics change, how you have to pick things up change, how you have to roll over in bed change, like everything changes so significantly in those 9 months, 9 to 10 months. And so just even being able to help kind of relieve some of those symptoms and just make sure that everything's working well and moving well and you're not compensating in an area, just to help you even as you're going into labor and everything like that, so you're not in pain, right?
I think that comes back to when I spoke about like the baby's changing so much, and you just said, you change so much in that 9 months, 10 months. And then after you deliver, so much changes during your delivery, and then your body doesn't just like stay in a position to deliver a baby. We have to go back. It's not going to ever be your pre-baby delivery normal. However, it's going to go back to your new normal. And so obviously our bodies go through trauma, whether or not it's a traumatic birth, but trauma when that baby's coming out of that 10-centimeter hole, right? And so how are we going to assist, like, getting our bodies used to those changes, postpartum?
The postpartum period I am so passionate about.
I knew you were waiting
So
for this.
yeah, I mean, I love treating my pregnant moms and I love treating my babies, but we'll talk about later my favorite part of my job. But one of the things, when you change so much after you have a baby, and same thing, like your biomechanics are still changed, and whether we're still in that anterior pelvic tilt or posterior pelvic tilt or however we were compensating when we were pregnant, our bodies are like, oh my gosh, what is happening? And we still have that hormone relaxin in our body after we give birth. That's one of the biggest things in pregnancy, where like all of those ligaments get super loosey goosey because they need to be, so that our pelvis can open up so that we can deliver a baby, but it can wreak havoc on so many other areas of the body. I find like a lot of my moms will come in and they'll be like, oh, all of a sudden I'm getting this knee pain that I haven't had since my injury when I was in grade 6. And they're like, why? This is the same thing. I don't know why. And it's because relaxin is coming back it's coming into our body and attacking all of those joints. It's like really great at what it does, but it can wreak havoc on other areas. But after we give birth, relaxin just doesn't go away in like 24 hours. Our hormone levels have to come back down. Our brain chemistry changes, our biomechanics change, our way of movement changes. We are also now lifting a baby and trying to figure out all of those different things. And so the one thing is when we are pregnant, we see our family doctor or OB or midwife or whoever we're seeing over 12 times, at least, in like a normal pregnancy. And then we give birth and they're like, here's your baby, we'll see you in 6 weeks. And then they're like, okay, you're good, go back to doing everything that you were doing before. And my biggest thing is 6 weeks is where your healing should start, not end. So everyone is always so focused on that. Oh, after my 6-week appointment, I'm going to get back into running. After my 6-week appointment, I'm going to do these things. And that's awesome, but you want to do it correctly, because we can, again, wreak so much more havoc on our pelvic floor, on our lower back, on so many other areas of our body, if we don't do it correctly and do it too fast. So I run a postnatal rehab class, which is one of my favorite things to teach. And yeah, we focus on so many of those things. So our pelvic floor, we do upper back strength because now we're carrying a baby that's not going to get any later. We work on retraining our glute strength and that coordination there. And then just our core and just like that whole breathing abdominal area. Because when we're pregnant, all of our organs kind of push up to make room for our baby. We start breathing super shallow, kind of up into our chest, and we need to retrain those breathing patterns in that postpartum period. So just really focusing on that 360-degree breath, bringing it back into the belly, and making sure that we're activating our transverse abdominis muscle. So when I'm telling people, I always say, okay, we're going to start working on our core. And they're like, oh, so I can start doing like crunches and bicycles and planks and all of those things. I'm like, no, we're going to go back to the basics here. So planks, crunches, and all of those things are all really great exercises, but those ones are primarily for our rectus abdominis.
Mm-hmm.
So our rectus abdominis is the one that sits on top, and it goes up and down. Whereas the one that we want to retrain after we have a baby is called our transverse abdominis. And so that's the one underneath, and it kind of is like a corset muscle. So it kind of wraps around like this. And I'm not sure if anyone knows what diastasis recti is.
I was just going to ask you about that.
Yeah, so this kind of goes hand in hand here. But so diastasis recti is an abdominal separation. So it separates right in the middle of our abdomen. Every pregnant mom by the end of their pregnancy will have some sort of separation in those abs, just because they have to grow and separate to allow room for that baby to grow. But we want to bring that back together after. So really bringing those breathing patterns back together and that coordination of that breath at that pelvic floor, because it is a canister in there and all of those pressures are working against each other. So we need to bring them back to working together. And yeah, so that diastasis, in my postnatal class, we work on bringing that back together. But we want to make sure that that is functioning correctly so that we don't get incontinence or lower back pain or any of those things. So just being able to contract that and utilize that how we should be using it after we haven't been able to for 9 months is very, very important, especially getting back into lifting and like running and all of those things. One of the things I always tell my pregnant moms, so if they have been coming to see me since pretty early in their pregnancy, I'll always tell them, sit up like a pregnant lady, because and they're like, what? And so basically all you do is you roll onto your side and when you get to that 30-week mark, you can't use your abs anyway, but
Yep.
I always start them early so that they get in the habit of any time that they're getting up off the table, up off of the couch, out of bed, they're rolling onto their side and using their arm to press themselves up instead of using that crunching position, because the diastasis is so much easier to prevent than it is to fix after. And it can lead to so many other problems after as well.
Yeah, I have had a couple of girlfriends that have had like a very severe case of that. And then it wasn't that long ago, I was going for like a pelvic floor assessment and whatnot. And she had been checking, and like I have a very, very mild, but I didn't think I had it at all. And so that's a very interesting perspective. And two, that I always think it's stress induced that I don't know how to fully breathe into my belly, but hearing you're like, yeah, during pregnancy, I'm like, that checks out. And so that is like something that I've really been trying to work on. But I think like I get so short of breath during my pregnancies. I have like the smallest torso. And so these babies don't have not a lot of room. And so I find I'm very, very constricted with my breathing, and it's a lot of effort to really learn to breathe back into that belly, and it doesn't feel like a normal thing for me to do.
Yeah. Right after my moms come in and I do an assessment, I'm like, okay, we're just gonna breathe, and then they start breathing, and they're like, I'm like, okay, so on the next one, we're gonna do it a little differently. Like, we'll just set that standard of that's how you're breathing right now, and then here is how we're gonna change it. And probably 90% of my moms are like, I don't know what I'm doing right now. My brain is like short circuiting. They're like, I can't do that. And I'm like, that's our homework. That's where we're starting. We're not starting with crunches and running. We are starting with breathing, which
Mm-hmm.
is super easy to do, and we do it every day, right?
Yeah, I know.
So
I
just
always
doing it.
joke that I'm like, I breathe, but I don't breathe.
Yeah.
I need to come back. And not only like obviously so many benefits for our body, but for that like mental health aspect, for the calming the nervous system. Like there's so many, benefits of doing that. And I think, obviously pregnancy is a significant amount of time, but also a small amount, but
Mhm.
large enough for us to get used to a new normal. And so when you're breathing that way and all of a sudden this baby comes out, that's not your focus. Is like you've gotten so used to only breathing into your chest that that's just what feels normal. And I'm like,
Mhm.
why am I always so short of breath? They're like, I don't know.
Yeah.
But, and two, I think while we're pregnant, we think of all these things. And then after we have this baby, well, you're so focused on that. You're focused, you know, healing the hole that the baby came out of, whether that's
Yeah.
abdominal or vaginal. And it's, all of these other things I think take a back seat when really they should be the forefront and drive that. And, you know, if your pelvis hurts several months after pregnancy, we're like, oh, what did I do yesterday or last night? I must have moved funny. It's like, no, I think let's go back to the pregnancy and, how did our body stretch, or postpartum, how did everything kind of come back together? And within that postpartum period, I mean, the hormones take way, like, such a significant amount of time to come back to normal. And so, especially like with breastfeeding moms and things like that, it takes even longer. And,
Yeah.
hormones play such a large part of our well being and our physical health and, mental health, everything like that. And so, I love that you said the healing should start at 6 weeks. Like,
Yeah. Not end.
no, and that's what we think. We're like, okay, we get past that 6 week mark, we are good. It's like, no, during that 6 week, you should only be like laying in bed or laying on the couch or small walks, like really babying yourself just as you do your newborn.
Yeah. Yeah. And I find too, like, we are so focused on this baby, which we should be,
Mm-hmm.
but we're 9 times out of 10, a mom is so focused on that they're not actually tuning into their body.
Mm-hmm.
And the first time maybe they bring their baby to see me, and the first time that they're asked, how are you feeling?
Mm-hmm.
Right? Like, I always make a point of like, okay, birth, you tell me that birth story. You're worried and focused on telling me the birth story about the baby. And then as we're kind of treating it, I'm like, and how are you feeling? How is your body? How
Mm-hmm.
is your, like, again, like, mental health? I've had some moms come in and just like, as soon as I ask that, they start crying. And
Mm-hmm.
I'm like, absolutely, this is a safe space.
Yeah.
You can let it all out. This is a total safe space. Um, yeah, just being asked that. And it's
Yeah.
like, oh my God. And even if it's not even like a sad cry, it's like, no one's asked me that. Everyone's
Mm-hmm.
always like, how's your baby? How's this? And so I always make a point of that. And then I usually always say, we also treat moms in here if I haven't been treating. If I haven't been treating them through their pregnancy, I'll always tell them, like, I do treat moms too. And we do our appointments back to back. So you only have to come once. It's not a huge thing. If you have multiple kids, bring them all. We don't care. We are
Mm-hmm.
such a family friendly clinic that we have toys in the front room. If your baby's crying, I'll send that baby out to the girls at the front, and they're going to cuddle that baby for the hour appointment that we do, or your 15-minute follow-ups, just so you even have 15 minutes
Mm-hmm.
or an hour of just like, this is for me,
Yeah.
not my baby now, right?
Mm-hmm.
So that is the one thing that why I'm so passionate about it, is because, yeah, you see your practitioners so many times before you give birth, and then as soon as you give birth, it's like, oh, no more.
Mm-hmm.
Figure it out. We'll see your baby a couple times, but unless there's a problem, we'll see you next time you're pregnant, right?
Yeah.
Like, and people don't also know that you can seek out that care, and especially chiropractic. Like, a lot of people don't know that you can come when you're pregnant, that you can bring your babies, that you can be treated after you have or give birth. Like, there are so many things we can do, and we want you to be comfortable, obviously, and we're not going to do anything that you don't want us to do, but there is help there for you.
Mhm.
And just, yeah, getting that education piece out there and allowing people to know that there are places that you can go. And if I can't help you, I will darn sure find someone who can.
Yeah.
And not just be like, oh, sorry, bye.
Yeah.
Um, I've had some moms come in and they feel like super brushed off by their primary care. And they're like, I think there's something wrong. And I'm like, okay, well, let's navigate this. Like, okay, I can't maybe refer to a specialist, but here's this other person that we can try and see if they can help us. Or
Mhm.
this thing is just not quite where we want it to be. Let's add this in. Um, so, yeah, I am such a big believer in seeing all of the practitioners and not
Mhm.
just like one, because everyone takes it in a different perspective. We also have massage therapy at our clinic. And so I love when my patients are go get a massage and then come see me, or I have a pelvic floor physio I'll refer to, or a pediatric physio, or acupuncturist, whatever. Just
Mhm.
like we all work so well together, and just that collaborative wellness care and that preventative maintenance stuff too. Um, you don't always have to have something. One of my really good friends never saw a chiropractor until I became a chiropractor, and then she came to see me and she was like, I don't really have anything going on. So she's like, I've just never had anything to complain about. And so she came, we treated her, and she's like, I never had anything to complain about, but I didn't know I could feel better. And
Yes.
so now she just comes and I see her every 6 weeks or so. And like she's active,
Mhm.
just making sure everything is how it should be, right?
Yeah.
So,
And we are. We're so active, and especially as moms and things like that. You're always have your baby on your hip, or you're picking them up, you're bending up and down, and it's just like different movements depending on your career too, right? Like all of those things. And I always say, like, I work with skin, and I'm always like, time and gravity, baby. Like
yeah.
pulling down, it's weighting. We got to work against that. And it's the same thing with our bodies and well, nothing about us is getting younger.
Yeah.
I always
Oh,
joke,
let
I'm
me
like,
tell you,
now that
30.
I'm 30 now. My back is shit. Like everything hurts. And I'm
I
like, it
know.
is. You need so many perspectives.
Yeah, absolutely. Yeah. Yeah. 30 kicked my butt. So,
Yeah. In many ways than one for me. I'm like, God damn. Everything just goes downhill from here. Whoever told me 30s are your best years, I think you're lying. Physically, anyway. I'm like,
I know I joke sometimes with my patients and they're like, just wait till you hit 40. And I'm like, oh, good.
great. Slow
Yeah.
down time.
So,
I don't want to get there too
right.
fast.
Yeah.
I think you did like a really good job of touching on like lower back pain, upper back pain in pregnancy and postpartum, but is there anything else that you think is important to kind of shed some light on in regard to those topics?
Um, yeah, I guess, I mean, like, just I take a whole body approach.
Mm-hmm.
So basically, just making sure that, okay, if your lower back is hurting, you're probably maybe compensating through your neck. Or like if you can't lift something, you might really pull through your shoulder. Um, I also always see when my pregnant moms come in, they're like, oh, my lower back and hips hurt so much. Then they give birth and they come in and they're like, oh, it's my upper back now because I'm
Mm-hmm.
carrying a baby in a car seat. Just using so many different muscles that they've never used before. And so, yeah, just taking that full body approach. I also um, do a lot of muscle work in my treatments. So I'm not just a chiropractor that when you come in, it's like, okay, you're here for 3 seconds. I'm cracking the same
Mm-hmm.
places every time and I'm sending you on your way. Yeah, we do that assessment and then I do a lot of muscle work. Like I said, I'm training craniosacral. I use Graston, which is another soft tissue technique, and a variety of different things. And then also, when it comes to the adjustments, if you guys don't want to be cracked, if you're scared of a certain thing, we're never going to do, or I'm never going to do anything that you don't want
Mm-hmm.
me to do or feel comfortable. So I always preface that. I'm like, have you ever had your neck adjusted? And they're like, no, it really scares me. And I'm like, okay, we don't have to do that. There's multiple other ways we can either adjust you with like the activator, which is a really light tool. I can just do muscle work in there and get some movement. There's a bunch of different things. I have a lot of tools in my tool belt, basically.
Mm-hmm.
So we don't always have to crack you just like everyone thinks we do.
Yeah.
Obviously, if that's what you want, we can as well. But yeah, I use the drop table, manual adjustments, there's the activator, so many different things. But yeah, I basically am like, I'll do something at the end of an appointment. I'll always ask, is there something that I did that you didn't like? And if they're like, no, everything seemed good. If they're like, yeah, I didn't really like that thing, I'm like, well, then we'll never do that again.
Mm-hmm.
We'll do something else. Sometimes it's like, yeah, I know this is going to suck because we're trying to get over an injury
Mm-hmm.
and probably not going to feel the greatest, but I promise it will help. People are always obviously more down for that, but yeah, just making sure that you're super comfortable in the space. And just like from the girls at the front to having we have extra diapers in the back if you forget your diaper bag, and like just being a peaceful place that people can come
Mm-hmm.
and just not feel anxious about like handing their baby over to a practitioner or yeah, just getting care. And one of the other things too is, like I said, we are a very family friendly clinic, and I have talked with a lot of moms and they're like, I just can't go for a massage, I can't go for physio, I can't go for these things because I can't bring my baby. And I'm just like, no, we need to have areas
Mm-hmm.
that, like, if you're on mat leave, who's looking after your 1.5 month old? Like,
Yep.
you got to bring them. Like, maybe they need to eat. Like, um, we need spaces where it's acceptable to bring your kids, and like, moms should not have that barrier of like, I can't get care because I can't bring my child with me.
Mm-hmm.
So that is one thing that we're very passionate about at our clinic, is that um, bring the whole family. We'll shove you all in the room and
Yeah.
we'll figure it out. Um, so yeah, just like removing those barriers and allowing that safe space for everyone, and like being able to like tell your story. And if you need that extra time,
Mm-hmm.
we can give it to you. And yeah.
I think that's so significant too, is like that how are you doing seems like such a simple question and something that we ask every day. If I see someone in the grocery store, hey, how's it going? And it's
Mhm.
like, but when you sit down in a situation like that and really ask, like, okay, tell me your birth story. And I think now we're doing a lot better at speaking of the birth story from a maternal and the baby perspective. Whereas I think sometimes we can get a little lost and hyper focus on like the baby. It's like, okay, I love to hear that, but I want to hear it from your perspective too. Like, what did you go through? What did you experience? Your body. Like, your body is the one who delivered this baby and
Yeah.
now is dealing with all those hormones and stuff, right? And so I think it's so important to put emphasis on that. And one of my favorite things about hearing your guys' voicemail is like, we can't come to the phone right now because we might be holding somebody's baby or we might be on the phone. And I'm like, oh, I'm obsessed with that. I think
Yes.
that's so sweet. And yeah, to find a place that, again, like even for this podcast, it's like, okay, I'm going to find somebody to watch the baby or whatever. And so, and it's like, that's in my own home, let alone trying to go to the massage therapy place. And it's like, okay, and then you have to physically leave and get there and take that space. And just knowing again that you can trust somebody with your baby, that is not an easy thing for everybody to do. It's
Yeah,
just kind of
totally.
hand over, right? And especially if you're in a, like, it's one thing when you're right beside the table and your baby's there, is different than, having someone holding your baby and you're in a room having a massage, not necessarily laying eyes, right?
Yeah.
Okay, let's talk. Okay, so when I was writing this out this morning, when I initially read your notes and I seen mommy's thumb, I'm like, what the hell is that? I assumed baby sucking on the thumb. And then as I'm writing it today, I'm like, I think it might be from like picking your baby up and stuff. Like, I think it's my thumb. And like,
It
why does my
sure is.
thumb hurt now that I know that? Okay, what is
Yeah.
mommy's thumb?
Yeah, so mommy thumb is a very again, common thing, but not always normal. Of after, yeah, you've changed how you're moving basically. So lifting your baby a lot like this, lifting the car seat. Um, Basically, it's a tendinosis in your thumb. So a lot of people will be like, oh, my wrists and my thumbs hurt. And I'm like, oh, you just had a baby. Let's do this test. And sure enough, it's positive. And you're like, oh, yeah, you have mommy's thumb. And they're like, what? I didn't even know that
Mm-hmm.
was a thing. Same sort of thing. Um, but yeah, there are things that we can help with in that regard. So a lot of it is obviously it's an overuse inflammatory condition. And so just kind of changing your biomechanics when you're lifting your baby, holding your baby, those kind of things. We'll have exercises to give as well. And then we kind of get into the musculature around there and adjust wrist and thumb and that kind of thing. One of my biggest things too that I give like my brand new moms when I'm treating them, just some tips. So when you're holding your baby, it's really, really common to like kind of cup them like this, just
Mm-hmm.
because obviously that feels really safe, but you're putting a lot of strain here on this thumb. So I always try to say, like, if you can, try and keep your hand flat and like hold that way, even if you have to use two hands. If you're like feeding, try to rest them on something and not like cock your wrist like this,
Mm-hmm.
um, just for preventative things. Of course, some people we can't fully prevent it from happening. Sometimes it will just happen anyways. But yeah, there's things that we can work through and address. And people are always like, oh, my thumbs hurt, my wrists hurt. It's probably just like something that I'm going to have to deal with. But no, there are things we can do to help. And again, you don't have to be alone in all of these things. You can always ask about them or
Mm-hmm.
that kind of thing. And sometimes people don't really know that chiropractors work on things other than just the spine. So if it's a joint, wrists, fingers, elbows, shoulders, knees, ankles, toes, we can adjust any of them. So like, did I get them all?
Yeah.
Um, so yeah, so sometimes some people come in and we've been working on their like lower back or something,
Mm-hmm.
and then they'll be like, okay, I don't think you deal with this, but I've been dealing with like an ankle pain. I'm like, oh, we actually do. So then it's just the education piece, right?
Mm-hmm.
And that's why I love like platforms like yours and even like you said, the social media aspect
Mm-hmm.
of it, of just like getting that information out there, because people don't know and they don't know where they can go for certain things. And they usually just assume like, oh, I just have to go to my doctor for this. But like your doctor, you can't see for another 2 months.
Mm-hmm.
And then by then you're just like in so much pain. And then it's like, okay, now we have so many more things or so many less interventions that we can do
Mm-hmm.
because this pain has been going on for so long. Chiropractors in Alberta can also send for x-rays and ultrasounds too. So if you, I've had quite a few like kids that play hockey and maybe have had a fall or whatever, and parents bring them in and we assess and we're like, oh, maybe we should send you for an x-ray, like
Mm-hmm.
just to be sure that it's not broken or whatever. But yeah, I have caught a few like fractures that either were brushed off by their primary care or
Mm-hmm.
we were their first stop, because I've kind of trained some of my patients to be like, you can come here, and if this is something that I send you to the hospital for, I will. I'm not going to
Yeah.
try and treat you in here. But we can always do those preliminary things, like if it's yeah, let's check if it's fractured or whatever.
Mm-hmm.
So instead of going to sit in the ER for 5 hours.
And again, those
But
different perspectives and stuff too, right? And
yeah,
I feel like our brain automatically jumps, oh, gotta go see my doctor.
yeah.
It's like, no, we have all of these other professions and trained professionals that can offer sometimes so much more depending on what the concern is, right?
Yeah. And of course, yes, some things you have to go to your doctors for. So
Yes.
yeah,
But it's nice to have the options, right? And
absolutely. Yeah.
we talked a couple times about the cranial sacral therapy. So I know people are going to be like, what is that?
Yeah. So craniosacral therapy is another technique. I took the first training, oh my goodness, 2 years ago now, a year and a half ago. And so basically it's another very light technique. So basically when we're learning it, they basically say like, if you're holding a nickel on your hand, that's the pressure we use when we do this. Our craniosacral system is another system in our body, and it has like a heartbeat, but it has its own rhythm. And so we basically feel for that. I do a lot of cranial on my babies, especially to help kind of calm down that nervous system. I do it also on a lot of my adults when I come in and I'm like, oh my gosh, they've had a very stressful week, a very stressful day. They've like literally the first thing I do when I walk in the door is I say like, hey, how's it going? And then they're like, oh, I'm like, okay, our nervous system is going to be up here. So sometimes I'll do craniosacral on them. So yeah, basically like the rhythm is when our craniosacral system that goes from our cranium, which is our head, all the way down to our sacrum. Basically, when that fluid is released, our system goes out. And then when it is resorbed, it comes back in and it has that rhythm like a heartbeat. So just like pumping out our blood. And yeah, so when our craniosacral system can't expand and contract, we're feeling for that. And so then we induce kind of a rhythm into the body to bring that back to its natural rhythm. And yeah, so we can do it in a various areas of the body, but a lot of them are around the head, inside the jaw, on the face, the neck. There's some by our feet. There's some, yeah. So there's a whole bunch of different areas for us to do. But yeah, it's more of like, I find a very calming technique. When I get cranio done, I just like, I don't know, I just like kind of melt and like everything just kind of goes away. It's also a really great technique for people with headaches too. So I kind of add a little bit of cranio into all of my treatments, but we do offer an extended cranio chiro appointment at our clinic. So it's a half an hour appointment. And I usually tend to do like classic chiro stuff for the first like 10 and then end with the cranio because it's so calming. And yeah, we just have some people that enjoy that extra, but I kind of add it in a little bit all the time. There's a couple moves that I'll do with most people just to help if they're super stressed or need that extra calming effect. But yeah,
I feel like we could all use a little bit of that.
Yeah, right.
Okay, pelvic floor dysfunction. What does that look like in your practice?
So kind of like when I was talking about my postnatal class, just bringing that awareness back to our pelvic floor. So if moms or even I've actually treated a couple males for like incontinence and stuff like that. But most of it is because I primarily treat moms and babies, but that pelvic floor dysfunction is sometimes comes from giving birth. Sometimes it's even when you don't give birth. So in Alberta, we are oh my gosh, we are not allowed to do like the internal assessment. So that's what a pelvic floor physio does. But I can assess through that like breathing pattern, talking about signs and symptoms. Our pelvic floor muscles also attach to our pelvis, and it's kind of like the bottom of our abdominal cavity. So if things in our hips our pelvis aren't moving well, our pubic bone's not moving well, our hip flexors are super tight and pulling and not allowing that contraction and relaxation of our pelvic floor, that can cause a whole bunch of other dysfunctions. So that incontinence, sometimes like constipation, not able to fully like void going pee, empty the bladder, that kind of stuff. That's one thing that we really want to retrain after we have a baby. So in that class that I teach, we really work on that activation and contraction of that pelvic floor. That is one reason why I love co-managing with a pelvic floor physio, because in our scope of practice, we can't do the internal stuff. So we send out to the pelvic floor physio. They do that internal checks to see, are we weak? Are we tight? Are there certain areas that need to be released? And then we kind of work in conjunction with that and making sure that everything's aligned properly, and so that everything can contract how it should be able to.
I think pelvic floor is becoming such a largely talked about topic. And so,
yes.
And it's like, I know I recorded an episode on it specifically too. So there's lots coming out on that, which I'm excited about.
Totally.
But it's like it's a sensitive topic and can maybe be embarrassing for some people, but it is such a
Mhm.
common thing. And so having kind of that multidisciplinary approach as well with you and the physiotherapist or pelvic floor specialist, sorry, to, make women feel comfortable enough to go for those type of appointments and to
Yeah.
have those concerns addressed, I think
Mhm.
is so important. And obviously to have somebody as passionate as you are about it makes an absolute world of difference, right? And
Yeah.
creates such a, trying time for women to hopefully ease it a little bit. But
Yeah. And I find that moms come in and they're like, "Oh yeah, like I pee myself when I laugh or
yep.
whatever." They're like, "That's a common thing. Like that's just a consequence of I had a baby."
Yeah.
And it's like you don't have to pee yourself for the rest of your life. There are
Hmm.
ways that we can help and focus on certain areas of our body that can help us not do that because it's no fun when I had a mom in the other day and they were like her her daughter, she would always be like, "Oh, I laughed and mom peed herself."
Yeah.
And then her daughter, when they go to the bathroom together, like looks at her underwear and like, "Oh, mom, you peed." And it's like,
Oh.
it's like, and they make a joke about it, but
Yeah.
it's like, there's things that we can do to help,
Hmm.
and not have to worry about that being a problem. And, yeah, just investigating why.
Yeah.
Why is that happening, right? And not just like, "Oh, I had a baby, so that's why." Um, Having a baby shouldn't be like a death sentence to having all of these things,
Yeah.
right? So, yeah,
I love that. Well, I don't love that she's having to go through that, but I love having a
yeah,
provider that's willing to investigate it, right? And again, and I think it too, men serve a purpose in the industry and things like that, but you know, male OBGYNs, or if they're doing anything like even, chiropractic, if they're able to assess the pelvic floor and stuff like that, they truly don't understand. And it's
yeah,
coming from like a different perspective, right?
yeah,
And so just again, I always come back to this whole dating providers thing and like really taking the time, like if someone doesn't give you the right answer, find somebody who will and that vibes with you and that you can really open up and discuss these concerns, address them, treat them, hopefully, get rid of them. That's the ultimate goal.
mhm,
But,
yeah,
and to being patient with the progress. Like it's not
mhm,
an overnight thing. I know sometimes I can feel that way too. I'm like, oh, I just wish, one time fix or whatever.
yeah,
But it's like really, you're worth it. You're worth taking the time to heal and to, obviously our pelvic floor health is not just peeing after. It's like, you want to be able to enjoy intimacy and you want to be able to, there's so many different things you want to be able to do. And it can
yeah,
stem from something that maybe feels so simple but is quite complex.
mhm. Even like you might not think it's a huge deal now, but when you get into your 80s and you haven't done that work back in
Mhm.
your 30s, chances are you're going to have a lot more problems in
Yeah.
your 70s, 80s as well. Um, Even like if you have a prolapse or anything of that
Mhm.
sort, things that we want to fix and catch before they become a huge issue later on down the line. Like you don't want to be 80 and being like, I don't want to go anywhere because I don't know where the nearest bathroom is.
Mhm.
Like it's one of those things that if you do the work earlier when you're able, it can set you up for much longer too.
Yeah.
Um, and like you kind of said about the finding that practitioner that you like jive with and that'll listen to
Mhm.
you. Um, Everyone's different. So, of course, just like chiropractors, everyone is different. All of the ladies that I work with, they're all wonderful, but we're all different,
Yeah.
right? So, just finding who works for you and also you don't have to feel bad about being like, oh, I really didn't enjoy that, I'm not going to go back. Like
Mhm.
I would much rather have someone find someone that they jive with than be like forced to see me or
Yeah.
something. And yeah, like everyone treats so differently. And like you said, like the male providers, as a male chiro, I don't know if I would address the pubic bone very often. It's such a sensitive area, and like just
Exactly.
like with liability and all of that stuff.
Mm-hmm.
So as a female chiro, I'm like, oh, I'm gonna be in this area. This is what you're gonna feel like, because
Yeah.
I'm a woman and I know what that feels like.
Yep.
Whereas if you're a man, you probably don't know, and
Mm-hmm.
same sort of thing. Like you don't want to put yourself into a position where it's like, oh, liability wise or whatever. So just yeah, finding those practitioners that you jive with,
Mm-hmm.
and yeah, that work with you.
Yeah.
So
Well, even as like a female nurse, I'm like, I'm more comfy around a female than a male, you
yeah,
know? Like, oh, gotta change you now. Like,
totally.
ah.
Yeah. Yeah.
What was I gonna say about that? I can't remember. Oh yeah, just really being in tune with your body too. Like, prior to pregnancy, like what was kind of your baseline? I'm not going to say normal, I'm going to say baseline. And then what was your baseline during pregnancy? And then what is our baseline postpartum? And like really connecting with what's really different here and what, can you live with versus what can't you? And in this present moment, but also like down the road, like we know our grandma's wearing continence panties. It's a thing. You're 80,
Yeah.
okay? The time and gravity thing. It's
Yeah.
it's bound to happen. And if it's not, you're one of the special ones.
Right.
And so just really setting ourselves up for success of like, what can I take the time to do for myself now? And they don't need to be big things. Like, there's different exercises you can do, like as you're just sitting eating dinner. And, it's just like learning to adapt those into your daily life. And again, we're so committed to our families and to our jobs and all of these outside things. And we really need to put ourselves at the forefront. Like we are just as important as these things that we have on our highest pedestal. Right. And,
Totally.
we can't I want to be able to go jump on the trampoline with my children, but hold up, let me go put on these incontinence panties,
Right.
like, and it's not just that, haha, I pee when I sneeze. It's like it's actually affecting your life if you can't chase your children around or things like that, right?
Yeah.
And it's not a death sentence, like you said, like just because you had a baby, we can have, a healthy pelvic floor regardless.
Absolutely. Yeah.
Be careful how you like
How you word that.
yeah. Coming from someone who's had babies, I get it. And
Yeah.
like you have not had a pregnancy or a baby yet. And so one of my questions for you is personally, like, not having gone through that yet, you are so passionate about helping these women. When did that start? How did you get into this line of work? Obviously there's so many avenues and things you can do in chiro. And so what about this screams like to your heart? Because it obviously does. Like you
Yeah.
radiate when you talk about it. And so yeah, tell me all the things.
Yeah. So as 18 and 20-year-olds, you don't know what you want to do with your life.
Yeah.
So, leaving high school, I knew I wanted to do something in the medical field of some sort, but I knew I didn't want to be on call.
Mm-hmm.
So that was like I don't want to be on call, and I don't really want to work nights. Those were kind of my like, okay, that's my baseline. And so I went into my undergrad and I did like all of the prerequisites for like pretty much anything I could potentially do.
Mm-hmm.
And, as you're getting into that like third and fourth year, you're kind of like, oh God, okay, what am I going to do next? And so my mom actually was like, you should go and start shadowing a bunch of places and like maybe go check out like chiro, physio, all of these things.
Mm-hmm.
And I actually had like a family friend's daughter that worked at this clinic. And so I reached out, and it actually is kind of a full circle moment because it's one of the girls now that I get to work with.
Oh my gosh.
So yeah, very, very small, like, yeah, very big, cool thing. But
Yeah.
yeah, so I ended up seeing a bunch of different practitioners. And like when I was growing up, chiropractic was kind of just like you go, get cracked, and
Mm-hmm.
you leave. And so I was kind of like, okay, like that's what a chiropractor does. and I actually shadowed my coworker, and I was like, oh, like there are so many other things that you can do as a chiropractor. And I was like, that is really cool. And yeah, so I left, and all of a sudden I applied to chiropractic school. I got in, I was moving countries, and then 3.5 years later, I was a chiropractor.
Oh my
So,
goodness.
yeah, it's like a kind of full circle, really cool moment that now, like one of the owners of the clinic I work at was kind of the one that I was like, oh, you do so much more. And
Yeah.
like, this is really cool. I'm going to research more into it. So yeah, in chiropractic school, we just kind of learn the basics, baseline. You can take extra trainings and stuff like that in pediatrics and pregnancies and sports and all of that stuff. And I was introduced, like I am very active. I play a lot of sports, and in growing up, that's how I was introduced to chiropractic care. And so in school, I was always like, oh yeah, like I'm going to be a sports chiro. That's just what I'm going to do.
Mm-hmm.
And when I was about to graduate, I moved back to Canada and did my last internship with a lady down in Okotoks, and she did a lot of like babies and pregnancy. And I just like, I don't know, I thought it was so cool. And I was like, there's so much value in this. And just like the moms that came in and left, and they were like, I haven't felt this good in so long,
Mm-hmm.
or like, I didn't know that this was a problem, or, and just like getting to watch her treat the babies and get some baby cuddles and all of that stuff. I was like, hey, this is really cool. Something that I should like maybe investigate more. And so I ended up taking some more courses and some extra trainings and getting my Webster technique and all of those things. And yeah, then my practice just kind of evolved that way. And it's, I don't know, it just like I was like, okay, here we go. Started, pandemic hit. It was kind of traumatic for the first year.
Mm-hmm.
And then, yeah, I just started posting and like just being passionate about what I was doing. And yeah, my practice just kind of like blew up and evolved into being a family chiro. And I like love going to work every day. And it's just like very interesting how it all evolved. And
Mm-hmm.
it was kind of funny. I was like actually just like thinking about this morning, because I was like, I'm sure you're probably going to ask how I got into this. And and so I was like, in school, there was a couple classes that I really wanted to take that were like sports focused,
Mm-hmm.
and it never aligned with my like clinic schedule and all this stuff. And I was like, maybe that was the world being like, you're not going to be a sports chiro.
Mm-hmm.
And it was like, maybe focus on something else. So yeah, I just really love the whole like family aspect of it. Like I see, I've treated so many families where I've treated the mom prior to being pregnant and seeing them in their like, oh, I'm running a half marathon world. And then all of a sudden they get pregnant. They see me through their pregnancy. They have their baby. I treat their baby. Then they have a second pregnancy and I treat their second baby. And now their 5-year-old comes in and like wants to be my best friend and like lays on the table. And
Oh,
it's just so like nice to kind of get to be part of their family a little bit.
absolutely.
And like, yeah, you're like, oh, what are you guys up to this weekend? Are you going to the lake with your family? Or
Mm-hmm.
like, what trips are you taking this year? And you just kind of get to know people. And then all of a sudden the mom's like, my husband's been complaining of XYZ, I'm booking him an appointment. And then get to meet the dad.
Like I
And there's
basically know
days,
you already.
yeah. Let's hear the other side of this.
Yeah.
um, and yeah, it's just really fun. There's some days where I literally have an hour in my day of just like mom, baby, dad, or
Oh,
like,
that's so special.
and then they send their moms in, so I get
Mm-hmm.
to meet grandma. And like, you're like, okay, clearly I'm doing something that's helping. And um obviously there's days where you're like, oh my god, I don't know if I did anything to help this person. And then all of a sudden their whole family's in there, and you're just like, okay, this is super fun. And it's so nice to have like, you're like, oh, they trust me with
Mm-hmm.
their family, with their newborn baby, with their pregnant body, with XYZ, right? So, yeah, basically that's kind of how, long story, how I got into where I am. And it's been over 5 years, which is insane to me that
Isn't
it's
it
been
crazy?
that long. Yeah. And yeah, I hit my 5 year in January. So it's just like really cool to look back and like reflect on
Hmm.
how things have evolved and like how much I've grown as a practitioner and how much I've learned and the different things that we can help with and do. And just like even the people that I've met, and like I learn something new every single day from my patients too. Like
Hmm.
I'm teaching them things and they're teaching me things. And it's just so fun.
I love that. Um,
Yeah.
I was thinking about this morning of like this being something that you're doing for the first time, and it was kind of on like your list of to-dos for this year and whatnot. And then you just saying about that, not aligning and different avenues. Anyways, I'm super into this horoscope thing right now, and this is the quote that came up this morning, and it made me think of you. But it says, "Allow yourself the chance to explore an idea that intimidates you, even if you feel you don't have the experience, the talent, or the connections you think you need to make it happen. Try it on for size anyway. If you've been longing to do something, even if you aren't prepared, that longing is leading you into a certain direction that you need to learn more about. Sometimes our greatest achievements turn out to be those that we never would have expected."
Yeah,
And
that's
here you
yeah.
are.
Yeah,
I'm like, shit, that checks out.
right? Yeah,
Oh, I love it when things work out like that.
totally.
Um,
Yeah. So,
Okay, well, that leads me to my final question for you.
hey.
And you already know it's coming. What is your absolute favorite part of your job?
So I would say my favorite part of my job is when I get to treat a pregnant mom, whether it's for the last 10 weeks, whether it's for their entire pregnancy, whether I'm the first one that they tell that they're pregnant, because that happens sometimes
Oh my
because
God.
we change things up, of course.
Yep.
And yeah, treating that pregnant mom, taking them to the point of when they go into labor, and then getting to meet their baby. I think that's like my favorite part of my job. And yeah, just like that trust that they have. They're like, okay, when can I bring my baby in? And so I always give that preface of like, whenever you feel comfortable.
Mm-hmm.
And all of a sudden you're like checking your schedule for the next week and you see their baby pop into your schedule and you're like, oh my God, I'm so excited. I get to finally meet them. We've been talking about this person, this
Mm-hmm.
he, she, they in your belly for 10 months or so. And now finally getting to see, like, oh, what color's their hair? What does
Yeah.
their face look like? What did you name them? I always ask, like, how did you guys come up with the name? Or like all of those things. So I would say that's probably my favorite part of my job. But up there with that is also just getting to meet the people that I get to meet. Like
Mm-hmm.
I've been connected to so many people through my job, you of course, and then hopefully a whole lot of other people through maybe this platform or like
Mm-hmm.
my Instagram platform. Just yeah, just like getting to meet so many cool people that do so many cool things. And um, yeah, there's just so many people out there educating, advocating, standing up for whatever they believe in, and giving platforms like this to talk about
Mm-hmm.
grief and all of the navigating of postpartum and pregnancy and just life in general. And it's just so cool to yeah meet all those people and just be connected in so many different ways. And like you said when we first started, I was telling you, I was like, oh, I know that girl from
Yeah.
when I was in junior high, that was on your podcast. And that happens so often in my practice. I'll be like chatting with them. I'm like, oh, like I grew up in Camrose, and they're like, Camrose, I have a friend there. And then I'm like, oh, who's your friend? And then they're like, blah blah blah. I'm like, oh my God, she's one of my best friends. And you're like,
It's
what?
such a small world, yet it's so
Oh,
big at the same time, right?
exactly.
And
Yeah.
yeah, I love that aspect about life and careers and socials and all of that, right? There's so many of us doing this thing we call life, and we're all just
Yeah.
doing it and doing our best. And I
Just
feel
trying to
like,
figure it out.
yeah, I feel like you really left it all on the table today, and I'm so proud of you. But is there
Thank you. Well, thanks
anything,
for having me.
yeah, is there anything you feel like you didn't put on the table you'd like to, or you're just,
No,
you're,
yeah, I think we got it all.
I think you did
I
amazing.
thank you. Yeah, I for all the people that are listening or
Mm-hmm.
connecting or whatever, just knowing that there's people out there to help you,
Mm-hmm.
whether it's me, whether it's your physio, whether it's your doctor, whether it's a girl you met on Instagram. Just, ask the questions and there's people out there to help you. So,
Yeah.
yeah, just
And if there's
that's kind of,
any time that someone makes you feel like there's a stupid question, I mean, move on, find someone new.
yeah,
Like,
totally. Yeah.
we're all
They're not your
learning.
people.
No, they're not. You don't
Yeah.
jive with them.
No, totally. No jiving.
Next.
Yeah.
I feel like we covered so much in such a short amount of time. I mean, an hour and 40 minutes is a long time, but I mean, I could talk forever. So that's a short time to
I
me.
know, same. I'm like, ooh, how do I nail down what I want to talk about?
I
And
know.
there's so many things. And like, even what we talked about just brushed the surface of all
Yeah.
the things that, chiropractic can help with, and like all of the things that I'm passionate about. And I guess one of the other things is I do my postnatal rehab class. And so following me on social media, people will know when the next ones are. So
Yes.
if anyone's ever interested in doing that, they can always reach out to me too. And I can tell you when the next one is. I try to do them I think there's usually twice a year, because I don't do them in the summer. We don't have enough people interested or around.
Fair.
So it's usually like a February, March, and like a September, October. So
Where
yeah.
can people find you on socials? That is like such an important piece, and I forgot.
That's okay. So I am at Dr. Alyssa Clarkson. So just DR and then my name on Instagram. And I think just Dr. Alyssa on Facebook. If you want to like book an appointment with me or want to know more, I am at Sublime Health. So we have, I think it's at Sublime Health on Instagram as well. You can give our clinic a call, and then sublimehealth.ca online to check out our website.
Sounds good.
But yeah.
And I'll attach all that in the show notes too. So
Yeah.
it's an easy one-stop shop. You can visit
Yes.
all of the things.
Yeah. But my Instagram is where you can find all of that too. So.
Thanks for listening to this week's episode. Please take a moment and on whatever app you're listening to us on, press that follow button to stay up to date with all future episodes. If you or someone you know are interested in being a guest on the Beyond the Birth Story podcast or a sponsor, please visit our Instagram or Facebook at Beyond the Birth Story podcast and send a message or fill out that contact form. I would love to connect with you. As always, remember to be gentle, kind, and hold space for yourself when you need it.